We're now going to start Unit 4. Unit 4 is kind of a collection of 4 chapters that do pretty much go together. Chapter 6 is going to be urinary system. 7 is male reproductive, 8 is female reproductive, and 9 is obstetrics and neonatology, so pregnant ladies and the babies that they have. So that's why we kind of lumped these 4 chapters together, because they are related. There are similar functionary parts that are used both in the urinary and reproductive systems. Each individual chapter doesn't have, a crazy amount of words like you might have seen in chapter 4, so that's why we're putting 4 together on a test as well. But here we go on the urinary system. It's fairly simple. It doesn't have a whole lot of pieces involved. You can see them pictured here as a general system. So first we're going to learn those parts and its function. Thinking about what the urinary system does, so obviously, you pee through your urinary system, so it's responsible for removing waste. By doing that, it's also regulating fluid volume within your own body. Within that, if you think about what your kidneys do and filtering and everything like that, it helps to maintain electrolyte concentration. And because of that fluid volume, that volume can also lead to pressure. So it assists in blood pressure regulation. So anatomically, males and females, their urinary system has all the same parts, but there are a little bit of difference in a couple of things. So, everybody's got kidneys, you have 2 of them. Everybody's got a ureter or ureter, depending on how you want to pronounce it, that goes down from the kidney. And you can see down to the bladder. The bladder, you can tell from male to female, does look different. The male bladder is larger, which is why women have to go pee more. And you can also see the uterus is smack right on top of the bladder, which kind of explains why pregnant ladies have to pee even that much more. And then from the bladder, you have the urethra. So for the male, that urethra is a lot longer and goes out through the penis. But for females, you can see it's much, much shorter. And there's a separate urinary meatus that exists for them. So there are a couple of differences, though all of the technical pieces are the same. All right, so as I mentioned, you have 2 kidneys. They're shaped like beans, which is why kidney beans are called what they are. They are situated on either side of the body. And then if you were to zoom in on one of these little segments here, and then continue to zoom in farther, our basic functional unit is called a nephron. And this microscopic structure is responsible for producing urine. And when I say microscopic, I mean microscopic because there's over 1 million of them located in each kidney. And there's all kinds of special functionary parts within a nephron, like the glomerulus and the tubules and everything else, but we're not going to necessarily go into any of that crazy detail, just knowing that the basic unit is a nephron. All of those nephrons together kind of pool in what we call the renal pelvis. It's a little funnel-shaped collection area that collects all the urine produced by the individual nephrons and then passes it down the ureter or ureter to the bladder. The ureters are 2 slender tubes, so they're about 1 foot long, between 10 and 13 inches, and they transport the urine that's created in the kidneys down to the posterior portion or the back portion of the bladder. The bladder itself is a muscular hollow organ, and its job is to just basically temporarily hold urine until you're ready to pee. The organ itself is one of the most simplistic organs that you have in your entire body. And this is one of the reasons why science today can actually 3D print bladders, which is kind of crazy. Once the bladder is full, then we reach the urethra, which is the lowest part of the urinary tract, and then it goes through the urethra to the outside of the body. And as I mentioned, for females, this is only about 1.5 inches, but for males, it's roughly 8 inches. So that's one of the other characteristic differences. The urinary meatus is the actual opening. If we've learned through the ear, we had the auditory meatus. Meatus just basically means an opening, and so in this case, it's the opening to the outside world. So just looking at the flow of urine, again, it's a basic kind of 4-part thing from the kidneys to the ureter to the bladder to the urethra, and then outside the body. So thinking about the differences, which gender do you think gets more bladder infections? Definitely female. Only because if you think about pathogens and things invading, it's a lot easier to get from the outside to the bladder for a female because the urethra is much shorter than it is for a male. All right, so now we're to the actual word parts. And there's not a ton, but here they are. If you have your diagram, you can label it appropriately. But cysto is what we've kind of learned to be bladder. Vesico could also be used, but generally we're going to use cysto to mean both bladder or a sac in general. If we think about when we learned the gallbladder, you had cholecysto for the bladder part. Glomerulo is for glomerulus. That's one of the functional portions of the nephron. Meato is for the meatus, so that's a general term that could apply to many body systems, but in this case we're going to talk about the urinary meatus. Nephro and reno both generally mean kidney. So for example, whenever you hear like renal failure, that would be kidney related. Since nephrons are the basic unit of the kidney, nephro means kidney as well. Pyelo is specific to the renal pelvis area. So that collection of where each nephron's urine output is collected, that's got its own term, pyelo. Ureter or ureter, again, I'm probably going to use them a million times interchangeably, means ureter, and urethro is for the urethra. So looking at this picture, we have renal pelvis and glomerulus. So renal pelvis would be pyelo, glomerulus would be glomerulo, and this is one of those easy things that you can kind of look to the word to spell it correctly. All right, so now we're getting combining forms that are used with the urinary system but don't actually point to specific structures in the urinary system, and a lot of these go along with what is in, what's floating around in the blood thanks to digestion that needs to get filtered out. So we have albumino, which is for albumin, and I'll kind of talk about that a little later. Azoto is urea or nitrogen. That's something, again, that needs to be filtered out of your blood, one of the functional parts of the kidney. Blasto we've learned before. That means developing cell. And again, that's such a general term that it can be a developing cell anywhere, but it'll show itself here again in the disease terms. Glycoso and glyco, you should instantly think of glucose because this means sugar. Hydro, I hope you know that that means water, not to be confused with hydro with an I from our chapter 4 section. Litho means stone. And we'll have, I think, another term, calculi is another one we'll see later that means stone as well, but litho is stone. Nocti, think of nocturnal. Nocti means night. And this is going to come into play because we are talking about the urinary system, night, like bedwetting kind of thing. Oligo means a few. So I don't know why I'm not good at history, but I always think of an oligarchy, which is a country ruled by a few, so that's how I always remember it. Urino and uro both mean urine or generally urinary tract. Like you would go to a urologist if you're having trouble with your urinary system. All right, moving on. We have a couple suffixes. There's no prefixes included in this chapter. Some of these you've seen before because we have been skipping around a bit. Iasis and esis both mean condition. And we've had condition before, so now we're up to like 3 or 4 different suffixes that mean condition. I'm fine if you use them interchangeably, just as long as you pick one that means what it's supposed to. Lysis would be dissolution or spreading or breakdown. Ptosis is drooping, in this case usually reference to a kidney. Graphy means suturing or repairing, so general it can really go in any chapter. Tripsy means surgical crushing, and this is going to be used for things like kidney stones. So instead of having a person just try to pass it, so to speak, oftentimes they might go in and mash them up or surgically crush them, and that's when you would have tripsy. Trophy is going to be development, hypertrophy, hypotrophy, that kind of thing. And urea is urine or urination. Okay, so I feel like this is just a reference to what we have seen before. We have not gotten to chapter 5 yet, but we have seen some of these suffixes before. So they have that RRH to it, and sometimes people use them interchangeably. So ria is going to be discharge. Ragia is basically excessive discharge. And graphy, like we just learned on the last slide, is for suturing something or repairing something. So which suffix denotes a surgical crushing? So again, in here they're showing you a kidney stone, and they are not going in with instruments in this graphic, but they are using a shock wave. So they put a little thing that sends kind of like sound waves that vibrate and then hopefully crush the stone that way. This would be a tripsy. Okay. So in this slide, a lot of people continue to get gram and graphy confused. So I just wanted to, again, reintroduce those here. Gram is the image. It is the X-ray picture that you get. So for example, a cystogram is the X-ray picture of the bladder. Please keep in mind that there was contrast media involved to make the bladder look as bright as it does in the picture. Graphy is the actual process of going through to get that picture. So for example, cystography is the process of taking the picture. You do a cystography to get a cystogram. Okay, we've successfully made it to the actual diseases and disorders. There is a lot of them, but again, from word parts, we just got to put them together. So for example, ozotemia would be urea in the blood, and that one's a little bit weird in the terms of how it is pronounced, because normally we start at the end of the word and then go to the beginning, but this one's a little bit different. It's also called uremia, just to mean like urine in the blood, because urea and urine are sometimes used interchangeably. There's a lot of itises, depending on what might be inflamed. I do have a suffix highlighted here, seal. I can't remember if we've seen it before, but seal means protrusion, or like a hernia, for example. A cystocele would be a protrusion of the bladder. It's sticking out in a direction that it probably shouldn't. Lith means stone, so depending on where you might have a stone, in this case it would be the bladder. Nephrolithiasis would be a condition of having kidney stones. Uretolithiasis would be having ureter stones. It's just basically where the stone has been made and where it's progressing. let's see. If you have a condition of water in the kidney, that would be an example of that. There are tumors in the kidney as well, so if you have a tumor of the developing kidney cells, that would be a nephroblastoma. If your kidney is developing too much or it's too large, you would have nephromegaly, because megaly means enlargement. And if you're, I'm not sure if we saw this, stenosis. Stenosis as a suffix means narrowing. So ureter stenosis would be a narrowing of the ureter, which can kind of be a problem because that tube needs to be open to transport urine. So if it can't do that, then that can lead to all kinds of problems. So take a look at these a little bit in more detail. Work on exercise 10 on page 203, and then we can move on to the ones not from word parts. As I mentioned on the last slide, hematuria is a little different, and we have ozotemia as well. So hematuria means you specifically have, okay, sorry, tiny interruption, but back to this slide. So we have hematuria, which means blood in the urine. So you have some kind of kidney injury or something like that, and you're peeing blood, essentially. Ozotemia means that you have waste products that should have been filtered out of the blood still in the blood. So you're not peeing blood. What should have been in your urine is staying in your blood is really the problem. So they're a little bit different. So hematuria is when you're peeing blood, like that's a symptom of a bigger problem. Ozotemia is its own separate serious disorder. Okay, so now we get to the ones where these are not built from word parts. And they get a little weird and tricky. So the first one is epispadiasis, if I'm pronouncing that correctly. And that is what, it goes along with hypospadiasis. It really has to do with where the urinary meatus is located. Sorry guys, but you know, if all is going according to plan, the urethra and the urinary meatus go right down through the center of the penis where they're supposed to be. However, congenitally, that does not always happen. So if that pathway and hole is above, then that would be epispadiasis. If it is below, like here, so this would be an example of hypo, it would be below where it's supposed to be. So the dotted lines tell you where it should have been versus where it is. Yes, this is still functional. It's just a little weird. So polycystic kidney disease is a problem where cysts, you can see here, continue to grow on the kidney and then begin to slowly interfere with its function. And it is a progressive thing, so it gets worse. And you can see if this is your happy, healthy kidney on the left, this is obviously definitely a problem. Renal calculi is another way to say basically a kidney stone. So like a renolith from word parts is the same as a renal calculus. So don't think of math, think of kidney stones. And then if you're going plural, you would say calculi. So if you have more than one kidney stone, it would be renal calculi. Renal failure just means that your kidney is not working anymore. So you can be diagnosed to be in kidney failure if it can no longer remove waste products from the body on its own. Renal hypertension. So if your kidney is not filtering waste products out of the blood and water out of the blood, then you can get an increased pressure in the blood, and so that's why it's renal hypertension. It's high blood pressure because of the kidney problem. Urinary retention means that you are having trouble urinating. So your bladder is filling up and you cannot empty your bladder for some reason. Urinary suppression is a kidney problem where you're no longer making urine. So then you can think about the consequences of that, and you're no longer filtering your blood, removing excess liquids. And then a UTI, or a urinary tract infection, is very general. It just means one or more areas of the urinary tract is infected. You can kind of have an upper and a lower UTI depending on where that is, but usually it has to do with the urethra, possibly the bladder. It becomes an upper UTI if it goes all the way up to the kidneys. Okay, so again, this picture just articulates kind of what I just said. You have a lower tract down by the urethra into the bladder, and then upper would be all the way up the ureter to the kidney. And you can see what that might look like in the bladder. So this is a cross section of the bladder. Inflammation of any of those areas can kind of be lumped under a UTI. So cystitis is a UTI. Urethritis is a UTI. But you can see it's not happy. Your book on page 205 goes through the different types of renal failure. I'm not going to expect you to know the breakdown. I just thought it was, interesting. It can be an acute problem. So something has happened to you, a trauma, a bad drug reaction, something where it's a sudden issue that can be reversed if you treat immediately. If it's a chronic condition, then it's progressive. It gets worse over time and you can't make it better. And then at a certain point, kidney disease turns into end-stage renal disease, where at that point the kidney, if left alone to function for you, could not keep you alive. All right, so stones in the kidney. Hopefully you're saying C, renal calculi. I don't know if it helps, think of throwing stones at your calculus teacher sometimes, maybe when you're learning math. All right, this brings us to our surgical terms. These are the ones from word parts. They are a lot, but they're all built from word parts, so look at the suffixes. They're pretty much all very, very similar. We have ectomies. You can remove a lot of stuff. We have otomies, meaning you can make incisions in a lot of stuff. If we remember, trypsy is the surgical crushing of stones, so that's what a lithotripsy is. Let's see. Lysis would be dissolution. Pexy has to do with surgical fixation. So if you have a drooping kidney and they need to put it back into place. Ostomy, if we remember, is creating an artificial opening. So if there's not a drainage problem. So go ahead and try exercise 18 on page 210, and then we'll go to the ones not from word parts. Okay, so to review, looking at this diagram, so in this case, they're making an incision into the renal pelvis to get a stone. So this one would be hopefully B. The only difference is an S. This is why spelling is so important. A pyelolithotomy is surgical incision to remove a stone. Ostomy would be creating an artificial opening to remove a stone. Okay. And I just gave it away. So this one would be creation of an artificial opening. In this case, if you are having ureter or urethra problems or anything like that, and you need direct drainage from the renal pelvis, then you would use this. It would be you could say rhinostomy, which sounds a little weird, or nephrostomy. Okay, so here's what it looks like to do the incision to remove stones. So your kidneys are more towards the back area of your body, so they would insert through the back, and then they would go into in this case, renal pelvis where the kidney stones are, and try to suck them up with a little vacuum. And this is called percutaneous because it's through the skin. They are not, slicing you open per se. They're just making a tiny little incision. All right. So surgical not from ward parts is a happy short list, though the picture is not very inviting for our male friends. The first one is, it's called ESWL, extracorporeal shockwave lithotripsy. Super long. It's also called shockwave lithotripsy. Extracorporeal just means outside of the body. So what they do here is they basically put a little pack on you that sends little shock waves over your kidney so that hopefully the stones break apart into tiny, tiny little pieces that then you can just pass naturally. Makes it much less painful. If that doesn't work, then they'll have to go in and surgically remove them, but that's the first. Fulguration is the destruction of living tissue with electrical sparks. So they basically kind of zap cells. This happens a lot for bladder growths, or if you think of the cystic kidney disease, they basically go in and zap little growths with electrical currents to prevent further growth. And then you can kind of see what that looks like in this picture here. If there's a little tumor in the bladder, they have this super long, awesome scope here, and then at the end, they have a little electrode that shocks the tumor cells. And then renal transplant, basically giving someone else your kidney. You only need one to survive. But interesting, so when you get a new kidney in a renal transplant, they don't actually take the bad one out. I don't know if all of you knew that, but if you think about, is it better or worse to just leave it in? You might have less complications if you just leave it in, because then you don't have to worry about, cutting the bad one out. So really what they do is they, leave whatever one is bad. So let's say the patient's right kidney is bad. They take the donor kidney and they basically reroute some of the arteries that were attached to the bad kidney, and they reroute them to the donor kidney, and then they connect the ureter from the donor kidney down to the bladder. So the bad one is still there and kind of hooked up partially, but then they put this new one in there and they kind of nestle it right by the iliac crest of your pelvis to help protect it. Okay, so now we get to the diagnostic terms. And most of these just have to do with visualization, so being able to see different things in your urinary tract. We talked about gram versus graphy earlier. So depending on what you're trying to get an image of, you'll have those differences. So cystogram and graphy would be for the bladder. Nephrography would be for the kidney. Renosonography, so that's going to be using ultrasound instead of x-rays to get a good idea of what's going on there. There's also something called a retrograde urogram. Retrograde just means that it's in the opposite direction as normal. So they would probably do some kind of catheter. So instead of going from like mouth down, they would insert a catheter going bottom up to look at what's going on. VCUG, voiding cystourethropography, that is built from ward parts. It's going to take an image of the bladder and the urethra. Again, this is going to be a radiographic image. And then there's a lot of endoscopic things. So you use a cytoscope to perform cytoscopy to look at the bladder, and then same thing with the kidney or the ureter. Take a break with these, just, get in the habit. Try exercise 26 on page 216. Here's an example left. We have a CT of the kidney. It's kind of hard to tell. You can see all kinds of stuff. This big white part right here is actually the spine. This is probably one vertebrae. You can see this is the hole for the spinal cord where that goes through. And then you can kind of see where this would be your kidney back here. and then you can see that there's, kidney stones in there. Renogram, again, these dark images would be the kidney stones that are within the kidney. Looking at ones that are not from word parts, in terms of diagnostic imaging, we have a cube. And this is looking simply at the kidney, the ureter, and the bladder, which is why it's called that. It's basically an abdomen x-ray, and they're looking for things like kidney stones or obstruction. So it's like a chest x-ray, except shuffled down to the abdomen. In the lab, there's tons of blood tests you can do to kind of look at the filtering aspect of the blood. So we have a BUN, blood urea, nitrogen to figure out how much urea is in the blood. If there's too much, that would signal a kidney problem. Creatinine is a blood test to measure creatinine in the blood. Again, if you have too much, it's a filtering issue with the kidney. Specific gravity, or SG, has to do with kidney function again, but in terms of how concentrating or diluting it can be for the blood. And then urinalysis, or UA, that's your basic pee in the cup test. So you pee in the cup and they run a basic panel for glucose, proteins, other things to kind of get general health picture. That's what a urinalysis is. So which of these can diagnose a stone in the tube leading from the kidney to the bladder? Hopefully you're saying C, ureteroscopy, because the ureter is the tube that connects the kidney to the bladder. All right, we're getting there. We are to the complementary terms. These ones are from word parts. So anytime we have urea, it's really in the urine. So if we have albuminuria, it's albumin in the urine. If you have sugar or glucose in your urine, it's glycosuria. If you have blood in your urine, weird, but you can have pyuria, which is pus in the urine. If you remember, pyo means pus, but you get rid of the O. If you have no pee or absence of urine, that's anuria, so not urine. If you have too much, or if you have too little, so you can produce urine, just not enough, that would be oliguria. If you have way too much urine, that would be polyuria. So there's differences in what's in your urine and the amount that you urinate. Nocturia, again, nocti means night, so this would be bedwetting or night urination. Let's see. Meatal is pertaining to the meatus, so looking at the urinary meatus. Nephrologist and nephrology, so if you need help with your kidney, you would go to the nephrologist. If it's general to the urinary tract, you would go to the urologist who studies urology. But I think that pretty much covers everything on here. So give exercise 34 a try. It's on page 221 in your book. These are the ones that are not built from word parts, and some of these you might have seen before or just know from your everyday life. Catheter, or cath, is a tube-like device that gets inserted up through the urethra to the bladder to kind of aid in withdrawing urine if necessary, or also instilling fluid. So if they're going to do some kind of x-ray that requires contrast media, they can do that too. Distended just means stretched out. So your bladder becomes distended as it fills with urine. Electrolytes is a general term. It just means like your minerals within the body. So thinking about all of the sodium and potassium, things that are in Gatorade, kind of. You need to have a certain balance to help your body function, and that's the kidney's job to do that. Enuresis is involuntary urination. So you are urinating when you don't want to. So think of nocturia, night urination. That's kind of like nocturnal enuresis. Diurnal enuresis would be daytime wetting. So if you have a super tiny bladder and you have involuntary urination. Okay. Hemodialysis, HD. That's basically something that people in kidney failure can go and do. It's a procedure, hooks you up to a device that basically allows you to remove the impurities from your blood because the kidneys aren't functioning properly to do that for you. Incontinence is the inability to control your bladder and or your bowels. So you can't necessarily control when you go to the bathroom. Micturate is the fancy word for urinate. So anytime you go pee, you can say micturate if it makes you feel more sciencey. Peritoneal dialysis is another version or another treatment for kidney failure. Peritoneal dialysis is another way to remove wastes from the kidney. It's just a different process where you kind of hook up a bag that collects all those bad things and you swap it out. But both hemodialysis and peritoneal dialysis are two different forms of blood filtering during kidney failure. Stricture means that you're having a narrowing of a tube in general. So in this case, it would be the urethra. So if you have urethral stenosis and that tube is narrowing, that could be an example of that. Urinary catheterization is basically the process of putting in a urinary catheter. You already know what a urinal is. Urodynamics has to do with the force and flow of urine as it goes through your urinary tract. So it's kind of like how much pressure, how much speed, all of that. I guess there's a standard way that should happen, and so if there's differences in pressure, speed, all of that, then it could point to certain problems. And then void just means to evacuate waste material. So kind of like micturate, it's just you emptying your bladder contents, for example. So go ahead and try exercise 37. It's fill in the blank. You can try 38 or 39. Those are matching if you like that better, on 224. So just to give you a little idea, again, electrolytes are different types of minerals in the body. And so if you've ever had to learn about action potentials and things like that, you need it to have your body function. And so certain things are listed here. We always think of sodium, potassium, but then we have chloride, carbon dioxide, and there's more. So pertaining to urine would be urinary. And you can see what that looks like here. So this is obviously a female, and you can see that it was inserted through the urethra, and then the little catheter portion is right here in the bladder. Okay, last but not least, you do have abbreviations to learn. I won't go through each individual one. They're kind of introduced throughout the chapter. So please make sure you go through looking at this. The only one we might not have specifically talked about is OAB, which just means overactive bladder. It means you have to pee a lot. But otherwise, everything is tied to some kind of disease or diagnostic procedure. You can practice these on exercise 41 in your book. Similar picture as I had before, which should give it away. Which of these is used to withdraw or instill fluids? If you're saying catheter, then you're on board, or cath. Okay. Abbreviations. What is the abbreviation for this procedure? If you can see, they are using shock waves to try to crush kidney stones. So this would be extracorporeal shockwave lithotripsy, ESWL. Okay, at the end of the chapter, as always, in this case on page 230, you get that paragraph that ties it all together. So please take a moment, read through this, see if you can say these words, if you understand them in context. Practice those multiple choices questions that tie it all together. Use your online resources, all of that good stuff, to hopefully tie it all together for you. And you've made it to the end.